Now in the next topic, the moment you look at this diagram, I hope all of you are able to appreciate that it is actually the back view. We are looking at this pectoral region from behind, guys, and I know my students are like expert in this diagram. They all know all the muscles present over here, guys. So above the spine you are able to see the supraspinatus, below the spine you are able to see the infraspinatus muscle there. But I am not interested in that one right now. I am actually interested about the remaining muscles present in this diagram. The lateral border of the scapula, you can clearly appreciate that this muscle here will be the teres minor muscle above. That's your teres minor muscle. Let me just zoom in for you people. And just below the teres minor, you are able to appreciate here, this will be the teres major muscle here. And then guys, this one has to be the long head of triceps, definitely. So in the back view, you are able to see the triceps muscle only. So that is the long head of the triceps. And without any doubt, what is this bone here, sir? This is the humerus bone. Now just try to understand the way how they are actually arranged, guys, the way they are arranged. So I hope you will be able to recall your MBBS days. We used to make a mnemonic. Okay. So take two fingers here like this horizontal. The one which is above will be the teres minor here, and the one which is below will be the teres major. So you can remember, it is easy to remember, guys. Most of the students will be even getting confused. Okay, sir, upar wala, the above one, is it minor, or the niche wala, the below one, is it minor? It's very simple. Below you are able to see your middle finger, your favorite one, the bigger one, teres major, and above it is teres minor here. So teres minor, teres major. Then take two another fingers here, long head of triceps, and this is the humerus here. Now just overlap like this here, guys. So this is the teres minor here, teres major, and this is the long head of triceps and humerus. Just overlap. And once you overlap like this here, you are able to see here a space form, quadrangular space, and below there will be one more space formed, lower triangular space, and there is one more space form above here, that is your upper triangular space, guys. So basically I am slowly moving towards the topic of intermuscular spaces, the spaces present in between the muscles. So you are able to appreciate here that there is a quadrangular space here, and then there will be a small space present below, that is lower triangular space there, and then one more small space present above here, that is the upper triangular space, guys. So these are the three intermuscular spaces that you have to learn, and better let's draw the diagram here together. So let us learn about the intermuscular spaces with the help of a small diagram here, guys. So imagine this one here to be the glenoid cavity of the scapula, and then if this is the glenoid cavity, definitely there will be head of the humerus here, and then on the lateral side you'll be actually having the greater tubercle there. So that's your humerus bone there, guys. So the scapula and the humerus. Now from the lateral border of the scapula, you'll be able to find a teres minor muscle above. And we all know very well, teres minor muscle will actually go and get inserted where, guys? It will be inserted onto the greater tubercle. I hope you remember that rotator cuff, sits muscle, in that SIT, supraspinatus, infraspinatus, and teres minor will also be inserted onto the greater tubercle. Then just below that, you'll be able to find teres major muscle, and that will be actually inserted onto the humerus bone only. So what is the muscle that is present above here, guys? Above you'll be able to find the teres minor here, and the one which is below here will be the teres major here. Fine, teres minor, teres major. Now once you are done with these two muscles here, the next one will be the long head of triceps. And I told you already, the long head of biceps and triceps are actually originating from the glenoid tubercle. And from infraglenoid tubercle will be the long head of triceps here. So this will be the long head of triceps here. Hope there is no confusion at all. So this will be the long head of triceps here. Now once you are done with all these muscles over here, guys, you can clearly appreciate the three spaces which are formed between them. So you're able to appreciate here, this will be the quadrangular space here, guys, and this below here will be the lower triangular space. The one which is below here will be the lower triangular space, and the one which is above here will be the upper triangular space. And once you draw a diagram here like this, you don't even have to worry about the boundaries. Don't even write down the boundaries. You can just imagine this picture in your mind, and you yourself can write down the boundaries, guys. I'll tell you, for example, if you just look at that quadrangular space, rectangle shape, what is present above that? Superior boundary. The superior boundary is nothing but made up of teres minor only. And what is present below that? Inferior boundary of the quadrangular space, that is teres major. And then medially you are able to see the long head of triceps and laterally humerus, guys. So boundaries you don't have to mug up at all. You can just look at the picture and answer. Now the most important thing is what are the contents, what is passing through that one. So let's deal with that one by one. So this space here is actually the quadrangular space. That is a quadrangular space. Now what is the content of quadrangular space? What is going to pass from here? That's the reason why just I have done the previous topic, nerves related to humerus. Come on, recall. In the nerves related to humerus, we have learned that there will be a nerve which will be actually taking a turn around the surgical neck of the humerus. That is axillary nerve. And along the axillary nerve, what is that artery present, guys? Posterior circumflex humeral artery. So these two structures are passing through the quadrangular space. It makes sense now. So therefore, number 1, axillary nerve, and number 2, the posterior circumflex humeral artery. There will be axillary nerve and the posterior circumflex humeral artery. These two structures are passing through the quadrangular space. They are the content of quadrangular space, guys. Next one. The space present below here, will be the lower triangular space. Lower triangular space. Now what are the structures which are going to pass through the lower triangular space? What is the content of that one, guys? So in this lower triangular space, we will be able to see one nerve passing from here. That's your radial nerve. And along with radial nerve, what is that artery, guys? The artery present along with that will be the profunda brachii artery. So lower triangular space will allow the radial nerve as well as the profunda brachii artery to pass. Profunda brachii artery. So these two structures are passing through the lower triangular space. Now the last and final one which is left out here will be the upper triangular space, guys. So this is upper triangular space. Now what is passing through the upper triangular space? We did not discuss this till now, guys. Let us discuss here. There will be one artery actually. There will be an artery here and that artery will be taking a turn like this around that lateral border of the scapula. It's taking a turn. And I said to you, in anatomy, whenever any artery is going to take a turn, the name of that artery will be the circumflex. And it is going to turn around the scapula. That is why the name of the artery will be circumflex scapular artery. Circumflex scapular artery. And that is going to pass through upper triangular space. So what is the content of upper triangular space, guys? Circumflex scapular artery. Circumflex scapular artery will be the content of upper triangular space. That's all. So in one diagram, we have concised all the 3 triangles, I mean to say all the 3 intermuscular spaces, and what is the content of that, and boundaries are automatically made easy, guys. So this is the best way to learn about the intermuscular spaces. That's all. We'll move towards the next topic now.